my session today is on history. Most of you are familiar, I'm sure, with it, but we have to go through it to get to the more specific topics of this training program. But I will just go through some of the key historical events and, of course, the guidelines which were formulated based on these historical events. And ethics, this is the definition here, but is different from law, which regulates the external behavior. Now, when we talk about ethics in medical practice, the first thing that comes to mind would be the rules for a good physician, and that would of course entail the patient-doctor relationship, confidentiality, so many other things which you are all familiar with. Then the Charaka Samhita or Sushruta Samhita, which everyone knows about also, and the Hippocratic Oath, which physicians used to take pertaining to the ethical practice of medicine. Now, the term bioethics was actually coined in the 60s, and one simple definition was that it was a study of moral values in the field of medical treatment and research. But the Encyclopedia of Bioethics, which was written by Warren Reich in 1972, he describes it as a systemic study of the moral dimensions, including moral vision, decisions, conduct and policies of the life sciences and healthcare, employing a variety of ethical methodologies in an interdisciplinary setting. So, you can see that we have an interdisciplinary setting. When we think of ethics in research, the first century physician Celsus, he actually said these words, which became a classic defense for hazardous experimentation in human subjects. He said it's not cruel to inflict on a few criminals sufferings which may benefit multitudes of innocent people through all centuries. In fact, he said this because he said there's nothing wrong to do research on criminals in Egypt. This was in Egypt, he said. And these wordings were used very often because they said there's nothing wrong in using this vulnerable population. Now, when you look at the early history, even the Old Testament, in the book of Daniel, there's a passage which describes a sort of experiment or clinical trial. And this happened actually after the king of Babylon conquered Israel. He wanted that several Jewish boys who were captured should be brought to his palace, and they should be treated like his own children. They should be fed and taught like his children. But Daniel, who was one of those children, he said that he didn't want to defile himself by eating the king's meat and drinking the king's wine. So he said, let's do an experiment. We'll have 10 of us who will be given pulses and we'll drink water. And at the end of that, then we'll see what happens. So it was actually a sort of trial right at that time. Then of course, Moses Maimonides, he was a Jewish physician, philosopher, and he taught that the physician should seek to help the individual patients, and they should not use them just as a way of finding new facts. Now, the first documented human participant research was in the 18th century, and at this time the scientists or the researchers, they did the experiments on themselves or their children or other family members. And examples of that are Edward Jenner, who tested the smallpox vaccine on a gardener's son, 8-year-old son, and then after that he tried it on his own son also. And then of course Johann York, he swallowed 17 drugs in various doses to record what happens. And of course Louis Pasteur is also there. So you can see at this time there were no guidelines, no rules, nothing. It was just an implicit faith in the physician. Whatever the physician told you, you went ahead and did. And in 1865, this noted French physiologist, he was the father of experimental medicine, he wrote the introduction to the study of experimental medicine. And he asked that, have we a right to perform experiments and vivisection on man? And he said that we should never perform an experiment on man which might be harmful to him to any extent, even though the result might be advantageous to science. The Neisser case, Albert Neisser, who was the discoverer of gonococcus, he actually did one study in 1898 where he injected cell-free serum from patients who had syphilis into other patients who were in the clinic who had other diseases. Now, most of these not participants, the patients that he injected the serum, they were prostitutes, and many of them developed syphilis. So he said that the vaccination doesn't work. That's all that he found from the trial. Okay, and of course, he was taken to court. Rather, the public prosecutor investigated the case, and he was fined by the Royal Disciplinary Court. And it was not questionable science that was the problem here. They said you didn't take informed consent. You didn't ask the patient whether she would want to be in the trial. That was more of a worry than the science part of it, that he had injected this cell-free serum. Now, probably the roots of informed consent have come from Major Walter Reed. Okay, he and 3 other researchers went to Cuba in 1900, and they started a study to detect the transmission of yellow fever. They were convinced that it was the mosquito which was transmitting the fever, and they had a very crude experiment. They used to have a mosquito inside the test tube, and they would invert that test tube onto the sick person, and then they would keep the mosquito for 2 weeks, and then they would again invert the tube onto a participant. So at that time they were still doing the experiments on themselves. Now, out of the 4 researchers, one of them had had yellow fever earlier, so he was immune to the disease. There was one scientist who developed the disease and recovered, and the 4th one actually developed the disease. He got the timing right and he died. So his was actually a success in terms of an experiment. It was a success. He was by the name of Jesse Laser, and he had kept a diary where he wrote exactly what he did, and based on this diary, Walter Reed conducted these experiments. And he promised to pay $100 in American dollars in gold to participants who came on the trial, and another $100 if they developed the disease. Okay, and this is, of course, is not clear here. This is actually the informed consent form. It was more like a contract, and they were told the risks and benefits. In fact, they were not really told the benefits. They were told that, you know, you will anyway get this disease, so it's better if you get it while you're on this trial, because then you'll get care and you'll be taken care of properly. So this was the informed consent form, and it's interesting to note that at that time also they had a duplicate in Spanish. They had an English form, and they had for the Spanish immigrants. Now, in 1900, this was actually related to the Neisser case, which was also just 2 years before that. The German government, they came out with the Berlin Code of 1900, and here they distinguished therapeutic and non-therapeutic research. But the regulations that they brought were for non-therapeutic research, and they were based on the principle of autonomy and informed consent also. So it was actually a directive to all medical directors of all hospitals from the Royal Prussian Minister of Religious, Educational and Medical Affairs. And as you can see, they already talked about human subject being a minor or non-competent. You cannot do trials on such persons. You cannot do it if they have not given unequivocal consent, and there should be a proper explanation of the adverse consequences. Now, Germany actually had a very good code of ethics, human experimentation code it was called, and this was in 1931. And here they actually gave the regulations for therapeutic and non-therapeutic research. And in this they specifically said that those who are doing non-therapeutic research, you have to get the informed consent before doing the trial. Whereas in therapeutic, they said in emergency conditions or based on the patient's interests, one could do a trial without informed consent. And they also said specifically that it should be tested in advance on animals in this trial. Now, this directive actually was present, but unfortunately the victims of the Nazi genocide were excluded from this based on a memo which was signed by Hitler, where he withdrew all rights of those prisoners to this particular rule. Now, research in the 20th century, we will of course first think of the Nazi experiments, World War II concentration camps, and there were many areas of medical experimentation, and I am sure you are all familiar with the various types of experimentation that was done on these prisoners. Probably one very infamous researcher or doctor at that time was Dr. Joseph Mengele. He was also called the angel of death. and he had this special interest on working on twins and gypsies. So he used to say that all the twins should be brought to his camp, and he would conduct all sorts of barbaric experiments with them. He would try to conjoin them, stitch them together. He would try to change the color of the eye. He would inject chemical substances to make it blue. He was trying to build the Aryan race. So he would do all sorts of experiments, which of course had no scientific merit at all. And the freezing experiments, in this they were trying to find out that suppose their pilots are drowned in the sea, how long would they survive till they die? That was one experiment. The other experiment was what are the various methods of resuscitation? What can we do to resuscitate these people? And of course, most of these prisoners died because they were just doing experiments with absolutely no meaning here. Then of course, the other experiments were the seawater experiments, where they were trying to find how to make seawater potable. So they would deprive the prisoner totally of food and give him only chemically processed seawater. And of course, the high altitude experiments, here they were trying to find out how long you could survive in this atmosphere. So they made low pressure chambers and put these prisoners into these low pressure chambers. There were a lot of sterilization experiments, and of course, most of these prisoners were sent to the gas chamber because they all suffered from radiation burns, and also there was, they couldn't do any work in the concentration camp, so they were sent to the gas chamber. Infectious diseases, there were a lot of studies on infectious diseases, but I think this probably is one of the most heart-rending stories of that time. About 20 children between the age of 5 and 12 were taken outside Auschwitz, and they were injected with the tuberculosis bacteria into the veins and the lungs. And then they were observed, they were examined, they were photographed, and their conditions of course deteriorated very fast. And on April 20th, just when the Allies were just three days away, they were taken to this Bühlenhauser Dam and they were killed, because the doctor who was in charge, he didn't want the Allies to find evidence of this kind of experiment. So he took them all to the basement and he's injected them with morphine, and it's really quite terrible because he hung them up on hooks, these children, and they all died like that, all these 20 children. And these are actually the real photographs of these children who were taken there. And now there is actually a museum there in that school. They've kept the cellar exactly how it was, and there's a rose garden behind the school where people can go and plant roses here. Then of course, you have the War Crimes Tribunal. The doctors, 25 doctors were taken to court, and this is the doctors' dock as they called it, and 15 of them were convicted, 7 were sentenced to death, 8 were sentenced to life imprisonment. When the sentence was handed down, they came out with something called the permissible medical experiments, which was actually the Nuremberg Code. And this Nuremberg Code, as you all know, is got 10 points, and the most important point here is that voluntary informed consent must be obtained, and that this is the investigator's responsibility. So Nuremberg Code turns 60 this year, like India also, so we have something in common. And of course, there are many other important points in the Nuremberg Code, that volunteers have the right to withdraw at any time, experiments must provide benefits for society, one should avoid unnecessary injury, and only qualified scientists must conduct this research. You have the Nuremberg Code also in your folders. Now, past misuse of research, there are many trials that were conducted, and I'll probably just touch on some of the most historic important ones. One would be the Willowbrook hepatitis experiment. This was done in New York, Staten Island, and it was done on an institution for mentally retarded children, where they wanted to find out the natural cause of hepatitis. So these children were infected with the virus. In fact, the first few children were fed stools of infected persons, and then the researchers said, no, there's nothing wrong in doing this, because anyway most of these children, they develop hepatitis while they're in the institution because they're not toilet trained. So so this way it's better because it's in research control situation, so there's no problem with that. and they also they closed the admission to the institution, and admission was only through the research unit. So parents were practically forced to put their children into this trial. So you can see there was no full disclosure at all. There was coercion under pressure and use of vulnerable subjects. Another study is the Jewish chronic disease study in 1963. Here cancer cells were injected into chronically ill, debilitated non-cancer patients to study the cancer to study immunity to cancer. And these patients were also not told at all that they were going to be injected. They just told them it's a skin test. And they said, we didn't want to tell them because anyway the cancer cells will be rejected, so why should we frighten them by telling them that we are injecting cancer cells. That is how they approached this. So there was again lack of informed consent and use of a vulnerable population. So recognizing the shortcomings of this Nuremberg Code, in 1964 the World Medical Association came out with the Declaration of Helsinki, which has been revised 5 times. The last version is in 2000, and of course there are 2 notes of clarification, use of placebo and post-trial access, which of course will be discussed in subsequent sessions. And actually this declaration laid the foundation to the fact that the participants' interest is more important than science. And also it came out with the recommendation that all protocols must be submitted to an ethics committee for review before starting the trial, and approval should be obtained. The Beecher article, the anesthesiologist Henry Beecher, this article is also in your folders. In 1966, he wrote in the New England Journal of Medicine, he described 22 studies which were done using very controversial ethics. They were done by reputed scientists and doctors and published in reputed journals. Some of the examples, one was for example the study on soldiers with streptococcal sore throat. Knowing very well that penicillin could prevent cases of rheumatic fever, placebo was given to these soldiers, and 2 of them developed rheumatic fever, 1 developed acute nephritis. Another interesting case was when the melanoma was transplanted from a daughter to her volunteering and informed mother in the hope of gaining a little better understanding of cancer immunity. They said that in fact the daughter died on the next day after the transplant, but they still said that this was something that it was a study that they could do to find out what is the the reaction to this, and the mother died on the 451st day due to metastatic melanoma. So there was actually no point in doing such a study, but these were the kind of studies that were being done and reported in reputed journals. And these were all the problems that were noted in these studies, different various like dangerous research, no informed consent. Dangerous research, they used to do cardiac catheterization on healthy persons also. These were the studies that were described in this. Use of coercion, deception, lot of problems that were there in these studies. Another study is the San Antonio contraception study. In this, Mexican American women who came for contraception were enrolled to study the side effects of oral contraceptives, and unknown to them it was a crossover design. So 10 out of 76 of these women became pregnant when on placebo. So the same problems, lack of informed consent, vulnerable population. Probably the most well known and horrific example of unethical research is the Tuskegee syphilis study, and I am sure all of you are familiar with it. And this study, for those who may not be familiar, this was done by the US Public Health Service from 1932 to 1972, which is 40 years, where they examined the natural course of syphilis in 400 African American men. These men were actually enrolled into the trial by telling them that they didn't tell them they had syphilis, they told them you had bad blood, and they didn't tell them that they were on a trial. They were told that they were getting treatment, and they were practically induced to come into the trial because they were given free food, they were given free travel, they were even given a burial stipend, because many of them they were all from a very poor part of Alabama, and they were offered this money, so in case you die, this is the stipend which will be given to your family also. Now, this is a letter which was written by the doctors to the patients, and this letter is actually a letter to them asking them to come for the spinal tap, and they were told that this spinal tap is a treatment. So, you can't see what's written here, but this last line is what is written here, and they say that, remember, this is your last chance for special free treatment. Be sure to meet the nurse, which was, please come along and do the spinal tap, and this is a free treatment. And as a result of this, there were 28 deaths, 100 cases of disability, 19 cases of congenital syphilis. Lots of problems in the study, isn't it? Lack of informed consent, putting their participants and families to risk, vulnerable population, withholding information, and no benefit at all to the participants. Tuskegee continued till 1997, when the former president of US, he apologized to the survivors and their families. There are a few survivors, about 8 of them were there, all over 90. Some of them were in their wheelchairs. This is also one of them. And he said that what was done cannot be undone, but we can end the silence. We can stop turning our heads away. We can look at you in the eye and finally say, on behalf of the American people, what the United States government did was shameful, and I am sorry. So finally, there was an apology from the government. In fact, I forgot to mention that when penicillin even was introduced, and it was well known that penicillin could cure syphilis, these patients were not given the antibiotic. And $7 billion compensation was paid to these survivors and their families. Now, lots of books have been written about this study, and there's a film also made called Miss Evers' Boys, which we are hoping to show you either this evening or tomorrow evening. And of course, there are several viewpoints. There are viewpoints from the doctor's side also. So, you will be seeing another article where the doctors have a different side to this story. The US government, the Army, the Navy all conducted research on participants. This study was actually done by the CIA, and it was called the Project MK Ultra. And it was a code name for a CIA mind control research program, where they tried, it involved the use of many types of drugs to manipulate people's mental state and alter their brain function. And it was started on the order of the CIA director. In fact, it was exported to Canada also. And the Dr. Ewan Cameron, who was actually based in US, he used to travel every week to the Allen Memorial Hospital in Montreal and conduct these studies, and he actually had a theory on schizophrenia. He said that you should erase the existing memories of the patient and rebuild the psyche completely, and he was paid $69,000 during this period to carry out these experiments. And in addition to LSD, electroconvulsive therapy was also used at many times the therapeutic dose. And these driving experiments, as they were called, it actually involved putting subjects into a drug-induced coma for weeks, sometimes even for 3 months in one case. And then they used to play tape loops of noise or simple repetitive statements. And it was conducted very often on patients who had very minor problems like postpartum depression or anxiety disorders. And by the time they came out of this torture chamber, they had decades of memory wiped out, and they didn't remember their children. They had to relearn bladder and bowel movement even. And it's interesting to note that Cameron was the first chairman of the World Psychiatric Association. He was president of the American and Canadian Psychiatric Associations, and very ironically, he was also a member of the Nuremberg Medical Tribunal. And actually a book came out in 1989 called In the Sleep Room, the story of CIA brainwashing experiments in Canada. It was a prize-winning book by Anne Collins, and a film was made on the book in 1998 called The Sleep Room, and that is when the public actually came to know about this study. Then they realized that even the Canadian government was involved in the study, and they had secretly given $500,000 to fund the study, the Canadian government also. And so finally, a lot of them have been paid out of court settlements by the US government, and also the Canadian government had to cough up about $8 million in compensation to these patients. Now, unethical research in India, there are lots of, but I'll just mention a few of them, which maybe some of the people who are not, who are new here can. This of course is well known, the pig heart transplantation done by Dr. Barua from the northeastern state of Assam, and he did this study with absolutely no clearances, no approvals. The quinacrine study, I think our DG mentioned this study also when he spoke on the first day here. This was a non-surgical sterilization study. It was done by the ICMR initially. They didn't find any benefits actually, but subsequently Medical College in Delhi, with all the approvals in place, did this study, and they obtained consent from the participants, and they had a lot of follow-up forms. All this revealed that there were no major side effects in the study, and they said it was useful. And at that time, after the study, a documentary was made called The Yellow Haze by students of one of the colleges in Delhi, which showed that actually these patients were coerced into the study and they didn't understand what they were going through. So informed consent was not really informed consent. And at that time, of course, it became a big scandal, and there was a big hue and cry, and Brinda Karat of the All India Democratic Women's Association filed this public interest litigation. The anti-cancer drug trial, which was conducted in Regional Cancer Center, Trivandrum, and John Hopkins, they did this study together. Many of you are familiar, I am sure. And here they said, actually the study, there was a whistleblower in this who came out and said that there is something going wrong here which is not right, and they said that the informed consent was not in the language of the participants in the trial, so they hadn't understood the informed consent. And finally, the John Hopkins University, they came out with the statement that one of its scientists tested experimental cancer drugs on patients without required federal or university approvals and without adequate preliminary tests in animals. So this scientist actually, she did the study in India without an institutional ethics approval, ethics board, ethics committee approval from Johns Hopkins, and she didn't have approval even to carry the drug to India, and it had not been tested on animals before it was started in Trivandrum. The gene therapy trial, this was done in the Metro Hospital between 98 and 2001, in which 16 patients with coronary artery disease were they received the vascular endothelial growth factor. This study also was done with no approvals absolutely in place, and it caused a huge hue and cry also. Now I'll just go back to 1972 when the Tuskegee trial, the Tuskegee study came out into the open, and they formed the National Commission for the Protection of Human Subjects in 1974, and they were given the task of coming out with the fundamental principles of research on human subjects, and they came out with the Belmont report, which tells you the ethical principles of research in human subjects. The Council for International Organization of Medical Sciences guidelines came out in 1993, and this is actually how to apply the Declaration of Helsinki in developing countries, considering their socio-economic circumstances, laws, etc. The SIOMS guidelines has been updated in 2002. Now the 1990s is called the decade of harmonization. Here the regulatory agencies and industry associations from 3 regions, United States, European Union and Japan, came together and they formed the International Conference on Harmonization. And this was done to standardize the process by which drugs are developed, tested and brought into the market. Then of course the ICH GCP, which is the guidelines of good clinical practice, which is the international ethical and scientific quality standard for designing, conducting, recording and reporting trials that involve human subjects. Now, what has India been doing? India came out with the first guidelines. ICMR came out with the first guidelines in 1980, and this is called the Policy Statement on Ethical Considerations Involved in Research on Human Subjects. So, you can see it came out just 1 year after the Belmont report. And these guidelines had these sections. They had sections on ethics committee, informed consent, clinical trials, research on children, traditional medicine and publications. This was the first guidelines that came out in 80. In 2000, these guidelines were revised, and in this there were two sections. There was the statement on general principles and the statement on specific principles. These guidelines have actually been drafted for legislation. We are hoping that by this year the guidelines will get legislated. This is the revised guidelines from last year, 2006. You all have a copy of that already. The term subject, which people don't like to use now, has been changed to participants, and there has been a lot of revision in the chapters, especially in these chapters: ethical review process, drug trials, ART, stem cell research and DNA banking. And these guidelines are available on our website also. This is actually the bill which has gone for legislation. It is called the Biomedical Research on Human Participants Bill 2000, Promotion and Regulation. The general principles, I am not going to go into detail. All this will be taken in the next session by Dr. Nandini. They are all just listed here. The general principles, ICMR principles. The specific principles is actually in 5 sections. It is clinical trials of drugs, devices, vaccines and diagnostic agents, herbal drugs, epidemiological studies, human genetics research, transplantation research and ART. The general ethical issues which are listed also in the ICMR guidelines are these: conflict of interest and post-trial access are the new additions to this ethical issues. Then of course, you have the Indian GCP in 2001, Schedule Y Amendment of Drugs and Cosmetics Acts in 2005. And here I have just listed all the codes of medical ethics. All this will be covered in detail in the subsequent sessions. Guidelines also. Those in purple are the ones from India. So you can see that India came out very, very early actually with their first guidelines. Now, besides the general guidelines that have been formulated, many specific guidelines have been formed by different agencies, and they are, for example, the Nuffield Council of UK has come out with guidelines on human genetics, human tissue, mental health, clinical trials, international collaboration, etc. And the UNAIDS has brought out consultative document on AIDS vaccine research. The NBAC of USA and the European Commission have also published consultative documents on collaborative research with developing countries. Thank you all, and end with this saying by Karl Popper. He said that the responsibility of our ethical dimensions are entirely ours and can be shifted onto nobody else, neither to God, nor to nature, nor to society, nor to history. Whatever authority we accept, it is we who accept it. We only deceive ourselves if we do not realize this simple point. Are there any questions?
Suppose the study has been done in this institution, and suppose something is intellectual property is there, and it should be going to that institution or that Indian government or a state government, but not that whole society. Means in that concept it is not a conflict of interest, because when we are participating, we know that if anything generating will be used for the human being, society. Society means in which sense? To that community, to that state, to that nation.
All these things are actually discussed during the ethics committee meetings, and it has to be decided before the trial starts, that what is going to be the benefit to the participant at the end of the trial. It has to be decided in the beginning itself, if something comes out of this research study.
I would like to know something more about the RCC John Hopkins study.
Which one?
RCC John Hopkins.
Because we have one of the members of the ethics committee of RCC. So I think I shall ask Dr. Nandini to explain, because she is actually now on the ethics committee of RCC. So she knows very much in detail about
Because in the last June workshop of ICMR, somebody told that accused person, She in fact presented the data somewhere.
The whistleblower.
He or
Okay. Okay.
Yeah, that was actually highlighted by one of the science writers also, that when a thing is banned, how is it that that paper was presented, and they also got some award or something like that. But then that person has been banned for doing research for the rest of her life. That is the action taken by the US government.
Yeah, she was planning to start a company also, no? You said after
No,
the trial.
there are a number of issues in that. In fact, the whole thing can be like Tuskegee, we can have a case study. The ignorance of the Indian side of people, the not so ignorant side of the US researchers, because the person who was involved was a lady who had done the experiments on her own, and like in conferences you meet people and then you develop relationship, and then you said, I have this, can we do the research and all those things. That's how the whole thing took place. And then I understand that she brought the drug with her, but she probably did not know that there are regulations in our country which do not allow that. Second thing is that she did not go through the ethics committee approval at all. There were 16 ethics committees in that institution that time. None of them saw that. And that was knowingly done, because in US they are very strict and everybody knows that. In India, the ethics committee who saw that were not so conversant with the rules and regulations of how to review a proposal. And there were lots of things taken for granted, like DCGI, the application had gone to DCGI, and the DCGI's approval had to be taken before initiating the study at that time. Nowadays you have ethics committees giving approvals. They can give approvals stating that subject to approval from DCGI. But those days it was not like that. So, and the DCGI's office, I won't name the person, said that, well, it was from Johns Hopkins, so we thought that nothing could go wrong. So they just gave oral permission, but you need to have written documents. So again, another GCP requirement. So a number of things were there. And then, of course, rivalry between investigators. So whistleblowing happened. But the procedures were not that very harmful, because it's supposed to be necrotic for the local tissue. But the whole procedure and the mechanism were not right. That's why it just blew up. And the person who was brought to the TV to say that he did not understand that the informed consent was in Malayalam and he is a Tamilian, also brought to light the fact that the informed consent should be in the local vernacular language or the language which the person understands. This person is from a cross-border area, definitely understands Malayalam, but he may not be able to read Malayalam. But then if you go to United States or Canada, where you have so many ethnic groups, how many informed consents have you seen translated into those languages? If you just see that, then why are we so harsh with ourselves? That's another question open to debate. So number of things were there. So anyway, the government was taken to task and all that, and then it had to show some action. So they said, ICMR person will be a representative in the new ethics committee. And since my boss was a very busy person, and she was in the inquiry committee also, which went into the details, and they didn't find anything very untoward about the whole study. It's all the processing, everything was not as expected. That was the main problem. So then I had to step in as a representative. And after that, they have done wonderful work, not because I was there, but because there are one or two members who are very well conversant. And I was very happy to see that the ICMR guidelines, in which I was so involved in getting it edited and bringing it to print, I had forgotten passages, but that person brought it up. And even the Malayalam translations used to go into such detail, and is a very old person. So it's the diligence and the sincerity which actually goes into the whole procedure.
Thank you very much.